Many patients come to see me for my expertise in the deep plane lower facelifting approach. I know it gets all very complicated, but I don't want patients to get caught up in the name of the procedure. There are a lot of terms being used to market facelifts these days. What matters to me is what we're actually doing underneath the skin and whether we're comprehensively addressing the anatomy that's causing you to look older. My approach is what I would describe as a preservation-style deep plane facelift. Rather than pulling or tightening the SMAS, the deeper supportive layer of the face, I believe it's important to adequately release the areas where those tissues are tethered. Once those attachments are released, I can reposition the deeper tissues of the face in a more natural direction without relying on tension on the skin to create the result. And that's an important distinction between SMAS facelifts and deep plane facelifts. I'm not trying to pull your face tighter, I'm trying to restore the tissues closer to where they used to be, while preserving as much of your natural anatomy as possible. The other part of this conversation that I think is really important and often gets overlooked is the neck. For many patients, particularly as we get into more advanced facial aging, simply tightening the SMAS or platysma muscle in the neck isn't enough. The neck has multiple layers, and depending on your anatomy, I may need to address the platysma, deeper fat, structures underneath the muscle, or other contributors to fullness and loss of definition. That's why I think of facial rejuvenation as a comprehensive operation. I'm looking at the cheeks, the jawline, the transition into the neck, and the neck itself. They all have to work together. My goal is not just to make you look better from one angle, or to give you a great jawline for the first few months. I want to create a result that is natural, balanced, beautifully defined, and designed to age well over time. So when you're researching facelift surgery, I wouldn't choose a surgeon simply because they advertise a deep plane facelift or any particular technique. Ask what they're actually doing. Ask how they are releasing and repositioning the deeper tissues. Ask how they approach the neck. And most importantly, look carefully at their results. Because ultimately, the name of the operation isn't what matters. It's the result that matters.